Neat freaks have OCD. OCD involves intrusive thoughts and compulsive behaviors that cause significant distress and interfere with daily life. Most people who are clean or organized do not have OCD. They simply prefer cleanliness and order. OCD's organizational component must be obsessive, constant, and often irrational, leading to repetitive actions. People with OCD feel compelled to perform certain behaviors to alleviate the anxiety caused by their obsessive thoughts. Therefore, cleanliness or organization alone does not indicate OCD. True OCD disrupts a person's ability to function normally in their daily life. Equating a preference for neatness with OCD diminishes the serious nature of the disorder. 5 stages of loss. The idea that grief follows 5 stages, denial, anger, bargaining, depression, acceptance, is a myth. Grief is a highly individual experience and does not follow a predictable or linear pattern. The concept of fixed stages can be misleading and may create unrealistic expectations for those grieving. People process loss in various ways that do not fit this model, with emotions often overlapping or recurring. Some may not experience all the stages, while others might go through them in a different order. The model was originally intended as a framework for understanding common responses to loss, not a rigid progression. Recognizing the uniqueness of each person's grief journey is crucial for providing appropriate support. Schizophrenia involves multiple personalities. Schizophrenia does not involve multiple personalities. It is characterized by symptoms such as delusions, hallucinations, and disorganized thinking. This myth confuses schizophrenia with dissociative identity disorder, DID, which involves multiple distinct identities or personality states. Schizophrenia involves a break from reality, where individuals may hear voices or believe in things that are not real. The misconception arises from a misunderstanding of what schizophrenia entails. People with schizophrenia may struggle with their sense of reality, but they do not switch between different personalities. This confusion can lead to stigma and misunderstanding of both conditions. Proper understanding helps in providing better support and reducing stigma. Bipolar disorder is just mood swings. Bipolar disorder involves severe mood episodes ranging from mania to depression. These episodes are far more intense than typical mood swings experienced by most people. Symptoms during manic phases include extreme behaviors like hypersexuality, increased energy, and decreased need for sleep, often leading to risky actions. During depressive phases, individuals may experience profound sadness, hopelessness, and lethargy. Bipolar disorder significantly impacts daily functioning and quality of life. It is not simply feeling good or bad. The mood changes are extreme and often disruptive. Understanding this distinction is vital for appropriate diagnosis and treatment. Anxiety equals constant worry. Anxiety disorders involve excessive worry that significantly interferes with daily functioning and overall well-being. Normal stress or worry is not the same as an anxiety disorder, which is more pervasive and persistent. Anxiety disorders can cause physical symptoms like increased heart rate, sweating, and trembling, along with psychological symptoms such as panic attacks and persistent worry. The intensity and duration of anxiety in these disorders are much greater than typical stress responses. Anxiety can also lead to avoidance behaviors, where individuals steer clear of situations that trigger their anxiety. It can be debilitating, affecting various aspects of a person's life, including work, relationships, and daily activities. Proper recognition and treatment are essential for managing anxiety disorders effectively. Sadness equals depression. Sadness is a normal emotion that typically passes with time. Depression involves prolonged and severe symptoms affecting daily life. Depression can include lethargy, sleep issues, and loss of interest. It is more than just feeling sad. Depression is not a real illness. Depression is a real and serious mental health condition. It can be debilitating and involves symptoms like lethargy and sleep disturbances. Depression affects daily functioning and requires treatment. It is not just a case of feeling down. Therapy is all about the past. Therapy addresses current issues and provides tools to handle present challenges. It is not just about analyzing the past. While past events may be discussed, therapy focuses on improving current well-being. The goal is to help clients with their present life. Mental illness is caused by bad parenting. Mental illness has complex causes, including genetics and environment. Blaming parents for mental illness is overly simplistic. This myth can harm the mental health of parents. Mental health issues cannot be attributed solely to parenting. LGBTQ individuals have mental disorders. Being LGBTQ is not a mental disorder. Historical mischaracterizations have been corrected in modern diagnostic manuals. LGBTQ individuals may experience mental health issues due to societal stigma. Their identity itself is not a disorder. Mental illness leads to gun violence. Mental illness is not a significant predictor of violence. Factors like access to guns and severe self-loathing are more predictive. People with mental illness are more likely to be victims rather than perpetrators of violence. This myth stigmatizes those with mental health issues. Trauma equals PTSD. Experiencing a traumatic event does not automatically result in PTSD. Reactions to trauma vary widely among individuals. PTSD symptoms are diverse and include more than just hypervigilance. Many people exhibit resilience after trauma. Men don't get depressed. Men can and do experience depression. They might express it differently than women, sometimes through anger or substance abuse. Men may be less likely to seek help due to societal expectations. Depression affects individuals regardless of gender. Antidepressants change personality. Antidepressants alleviate symptoms of depression and anxiety. They do not change one's core personality. The goal is to help individuals return to their baseline selves. Properly prescribed medication should not alter fundamental personality traits. Medication alone cures depression. The most effective treatment for depression often combines therapy with medication. Relying solely on medication is less effective. Therapy addresses underlying issues and provides coping strategies. A combined approach is typically more beneficial. Therapy is only for the weak. Seeking therapy requires strength and courage. It involves addressing and working through personal challenges. This process can be difficult and requires resilience. Therefore, those who seek therapy are often among the stronger individuals. Talking about painful topics in therapy is harmful. Discussing painful topics in therapy can be beneficial for long-term healing. It might be challenging initially, but it helps in processing and resolving issues. Therapists are trained to handle these conversations sensitively. Addressing painful topics is part of the therapeutic process. Therapists will make you talk about anything. Good therapists respect clients' boundaries. They will not force clients to discuss topics they are not ready to address. Therapy is a collaborative process. Clients have control over what they choose to discuss. Psychiatrists are the only mental health professionals. Psychiatrists prescribe medications, but psychologists and other therapists provide valuable therapeutic interventions. Different mental health professionals offer various types of support. Therapy often involves psychologists, social workers, and counselors. Each professional has a unique role in mental health care. Therapy takes forever. Therapy duration varies based on individual needs. It doesn't have to be a lifelong commitment. Some people benefit from short-term therapy, while others may need longer support. The length of therapy is tailored to the client's goals and progress. Friends can substitute for therapists. While friends can provide support, therapists are trained to handle specific mental health issues confidentially and professionally. Therapists offer objective, evidence-based guidance. Friends might lack the expertise to provide effective therapeutic support. Professional therapy and friendship serve different purposes. People with PTSD are hypervigilant. Not all individuals with PTSD exhibit hypervigilance. PTSD symptoms are diverse and can include flashbacks, avoidance, and emotional numbness. Each person's experience with PTSD is unique. Hypervigilance is just one possible symptom. Only severe trauma causes PTSD. PTSD can develop from various types of trauma, not only severe incidents. It depends on individual perception and response to the event. Both major and seemingly minor traumas can lead to PTSD. The impact of trauma is subjective. Myers-Briggs is a valid psychological test. The Myers-Briggs type indicator is not scientifically validated as a reliable measure of personality. It is based on Jungian theory but lacks empirical support. While popular, it should not be used for serious psychological assessment. There are more reliable personality tests available. Mental health services are expensive. Affordable therapy options exist, such as training clinics where practitioners provide services at reduced fees. Many organizations offer sliding scale fees based on income. Community mental health centers can provide low-cost or free services. Mental health care can be accessible regardless of financial status. As we wrap up our discussion on mental health myths, it's important to recognize the strong connection between mental health and diet. For a deeper dive into this topic, watch our video on diet misconceptions, where we debunk common myths about nutrition. Join us to further enhance your knowledge and make informed choices about your diet and mental well-being.